Knock, knock. Hi guys, I'm dermatologist Dr. Abby Waldman, and today we're going to discuss how to treat acne scars faster. So there are two general categories of acne scars, and how you treat them is going to depend on which category you fall under. So the first category is superficial acne scars. So superficial acne scars would include redness, red scars, erythema, or hyperpigmentation, dark scars. Generally, these are superficial. There's no texture change. They feel flat against your hand. The good thing is, if you fall in this category, that these usually resolve on their own over weeks to months. You can speed up this process by doing some home treatments and procedures that we will discuss in this video. So the other category of acne scars are deeper acne scars. These include atrophic, meaning depressed scars that you can kind of stick your finger into, or hypertrophic scars. Those are elevated above the skin. If these are very mild, then they can resolve over time with home treatments, but if they are moderate to severe, you're going to need to see a dermatologist or a physician in order to get appropriate treatment to help these resolve. We're going to discuss all the treatments here, but it is important to remember that you have to get your acne under control before focusing on the acne scarring, because if you have new acne lesions coming up, you're going to get more scarring. And as the saying goes, an ounce of prevention is worth a pound of cure. It is a lot easier to treat acne as is coming up than to treat the scars once they have occurred. So really focus first on treating your acne, even if that means seeing a dermatologist, even if that means, deciding to take some medications for your acne, because it really can help prevent a lot of distress and scarring down the road. So jumping into the first type of acne scarring, superficial, we're going to discuss erythema and hyperpigmentation. So if your skin looks like this and you have mostly pink or red flat scars or marks where your acne was, the good thing is, the reassuring thing is that these generally resolve on their own over weeks to months, especially if you don't pick them and if you stay out of the sun. But if you're like, Dr. Abby, I am getting married in 3 weeks. I do not have many months to wait to get this better. Then we're going to discuss some hacks and some tips here to help fade that erythema, or at least hide that erythema. So the first goes without saying, sun protection. I don't care if you use a really big hat, you just stay out of the sun, avoid the sun. Sunscreen, the best is tinted mineral sunscreen for erythema. Whatever your sun protection of choice, it is critical that you do this to avoid further erythema and further hyperpigmentation. Second tip, continue your acne medications if you're already on them. So if you are already using tretinoin or other retinoids like adapalene for your acne, continue that, because not only will that prevent other acne from coming up, but it'll also actually help turn over the skin, help with remodeling, and help that acne scar heal faster. If you aren't already on acne medication, and let's say you're not seeing a dermatologist, one at-home retinoid that you can consider, which is usually kind of the beginner acne medicine, is adapalene. I would recommend that you start it just every few days when you're first starting, because sometimes it can cause a little bit of acne breakout, things to come to the surface. So maybe a little bit dicey if, again, you're getting married in 3 weeks, you might not want to start a new acne medicine right before that. But if you have the time, retinoids really can help the healing process. So certain lasers and light treatments can help fade redness faster. The main one is PDL, pulse dye laser, and then also other light treatments like IPL, intense pulse light, can help redness fade faster. Now, you're not going to see reaction right away. Usually it's like a week, 2 weeks where you start to notice some difference. Sometimes you need more than one treatment, and they're often spaced about a month apart. So keep that in mind if you are looking to get kind of like a fast fix. This can help it fade faster if you have an event, but you really still do have to incorporate some amount of time and healing into that process. And these are expensive procedures for something that's going to, fade over time on its own. So keep that in mind, but the lasers and the light treatments can help fade it faster if you are time constricted. So what about some quick fixes if you have an event later tonight, right? You had a pimple last week and you have some redness. You can actually see I have this like recurring pimple right here. And I often will have like a little bit of redness here that can last for a few weeks after the pimple goes away. So one thing that you can do if you just need a little bit of redness to go away by the end of the night is to apply a little bit of Afrin. Oxymetazoline is the active ingredient in Afrin. It constricts blood vessels. So just like it helps with rosacea, it can help with redness from post-inflammatory acne. Now this is not a cure. This is not a like full fix. This is a one night, I need to fade this redness, in a few hours. It usually takes about 1 to 3 hours to take effect. It will wear off by the next morning. So this is not a long-term fix, but it can help cosmetically if you have a short-term thing. The other thing is makeup. So red is balanced by green. Anyone with rosacea knows this because oftentimes you will have a green primer. So you can use like a green primer or a green concealer and apply that right over the red, and that's going to hide the red much better than if you use like a skin-colored concealer. You can apply skin-colored concealer over the green as well, or just like your regular makeup. So that's like a little bit of a hack, a tip. If you have, again, like something that night, you need to get it covered and look great for your big event. Okay, moving on to hyperpigmentation. Again, this is hyperpigmentation where the scars are relatively flat. There's not a whole lot of texture change, maybe slight texture change, but you can't really like stick a pencil tip in there. So if this is what your skin looks like, again, rest assured that most of the time this is going to resolve on its own. It is going to take longer than the redness to fade, usually somewhere between months and even up to a year. You may be more prone to hyperpigmentation if you have a darker skin tone in general. And even though it will go away on its own if you stay out of the sun, there are some things that you can use at home in order to help the hyperpigmentation fade faster. So again, number 1, number 2, number 3, sun protection. Say it with me, sun protection. Again, I don't care if you're like, I hate sunscreen, I never wear sunscreen, fine. Put like a little pimple patch over it so it doesn't get sun. Wear the biggest hat ever, just to keep yourself out of the sun. Sun is going to increase the hyperpigmentation that you have in that area. So if you're not doing sun protection, you might as well just turn off the video now and not do anything else in the video, because that is so crucial in helping to fade the hyperpigmentation. So what ingredients can you get at home? So the first one that's probably the most powerful is now only by prescription. It used to be over the counter at lower percentages, and that's hydroquinone. Hydroquinone is probably the most effective topical treatment for hyperpigmentation. That being said, it is also the most likely to cause irritation and redness, and so that is why it is controlled by prescription only now. Oftentimes it's compounded with a retinoid, which I mentioned can help turn over the skin and the scar and help it heal faster. And it's often compounded with like a little bit of a steroid, which again decreases redness and decreases inflammation. But this is prescription only, so you talk to your dermatologist or your doctor. Again, it works the fastest, but it can be a little dicey because it has more side effects than some of the other topicals that we'll discuss that are all over the counter. So over-the-counter treatments for hyperpigmentation, the one that I like the most is azelaic acid. I use the one by The Ordinary. I must have left it downstairs. And it's great for both redness and hyperpigmentation. Again, retinoids. So if you are already using a retinol, or if you're already using acne medicine like adapalene or tretinoin, continue to do that. It will help reduce the hyperpigmentation and erythema. In terms of if you need to start a new treatment, if you're not already using one, retinol will help with hyperpigmentation, but it's not going to help with acne. Whereas the adapalene or the other prescription retinoids like tretinoin help with both. They help both with hyperpigmentation and with acne. So just keep that in mind when you're deciding which treatment to choose. Other ingredients to look for are kojic acid, tranexamic acid, and then lower down on that list, I would put niacinamide, vitamin C. If those are the only ones you're using, you're not going to notice like a huge difference in your hyperpigmentation. Even though vitamin C is like the wonderkind of social media, really, it has a modest effect on hyperpigmentation. It is not going to be as strong as some of these other treatments that I recommended. And then last, just exfoliating regularly with an AHA, BHA, whether that's glycolic acids, acid, salicylic acid. These can really help turn over the skin and again reveal like some new non-hyperpigmented skin underneath. You don't want to overdo this though, because it can lead to more hyperpigmentation and erythema if you overdo it. So again, you maybe once, twice a week, either in the form of a toner or as a chemical peel, which we will discuss shortly. So the nice thing about a lot of these is that you can kind of use many of these topical treatments together and they actually boost the effect. So one that I like is Lion Pose Unspotted 4X. This is from Sephora. It has a mix of different ingredients that I already mentioned to fade hyperpigmentation. The other one is Faded, and again combines many of these products that I recommended all together, and each of them kind of boost the effects of the other. So what about at-home procedures? So home microneedling, this is the Banish stamping tool. You know, this can help quite a bit to turn over skin. It can reduce hyperpigmentation and even help with like some mild textural change. LED light can help as well. Red light generally will help with acne, hyperpigmentation, and redness. So if you're looking for something to do at home that's going to help pretty mild, superficial acne scars. So you can go get an in-office procedure for mild acne scarring and hyperpigmentation, and often they really will work to help hyperpigmentation fade faster, but there's a few things to consider. So the first is that lasers like Fraxel and Nd:YAG that can help with hyperpigmentation are quite expensive and often will need more than one treatment. So they're not sort of like a one and done type of thing. There's a danger in certain skin types and certain skin tones that you actually increase hyperpigmentation. So if you're going to go and get any sort of laser in particular, you really want to go to someone who's highly trained, has done many of these procedures before, and you really want to go to somebody who's highly trained in darker skin type if that applies to you. The other thing to consider is just cost. So remember, these are going to fade with time. All of the topical at-home procedures and skincare that I mentioned are going to help your scars fade faster. So do you really want to invest hundreds of thousands of dollars to get there maybe a little faster, but maybe not, and often with more complications. So keep that in mind. Talk to your physician or your dermatologist if you have questions whether in-office procedures are right for you. Okay, so moving on to deeper acne scars. So within the deep acne scars, we have atrophic scars and hypertrophic scars. So basically, these are atrophic scars. You can stick a finger, stick a pencil tip in. They include ice pick scars, boxcar scars, and rolling scars. And if you have moderate to severe atrophic scars, most likely the at-home procedures are not necessarily going to work for you. So the microneedling, some light chemical peels, the topical treatments, all of those are best for mild to maybe like early moderate acne scarring, but anything deeper is going to need an in-office procedure. And which in-office procedure is kind of going to depend a little bit on you. It's going to depend on your coloring, on your skin texture. It's going to depend on which of these type of acne scars you have. And you want to go to somebody well-trained in treating acne scars who can really pick the right treatment for you, because there are many. And while I'll review them here, each practitioner is a little different. Which ones they offer really vary on where you are. And so just keep that in mind. So the first, we'll talk about microneedling. So again, we talked about at-home microneedling. These at-home microneedling devices like the Banish has 0.5 millimeter depth needles, so it's not going in particularly deep. So again, great for very superficial texture changes. If you have deeper scarring, then you are going to need deeper, longer needles. And in-office microneedling can offer up to 2 millimeter depth needles. It's getting a lot deeper in the skin, and you're really starting to turn over, causing these little micro injuries in the scar that trigger the body to heal the scar, really fill in that atrophy, that divot that's part of that acne scar. The nice thing about microneedling, generally thought to be safe for all skin tones. The downside is it might not be enough for all types of acne scars. So moving on to chemical peels. Chemical peels, again, can go from really superficial at-home chemical peels like salicylic acid, glycolic acid, great for your, hyperpigmentation, your more superficial types of acne scars. And your in-office chemical peels can go very, very deep and really change the whole texture of your skin. But there are a lot of downtime related to that, a lot of complications, and much more risk than these superficial peels. The sort of medium depth and deeper peels include like a retinoid or vitamin A peel. TCA can actually be used in a very focal manner it's something called TCA cross, where you make these little holes in the acne scars and kind of deliver the chemical peel right to the acne scar. And then there's very deep ablative peels like phenol peels, which require a very specialized physician to perform. Again, all of these do have a risk of increased hyperpigmentation, especially depending on which skin tone you have. So lasers, moving on to lasers. You can get like a whole talk just on lasers. And again, the brand names of these is not important. There's different brands that make different types of lasers. A little bit's gonna depend on what laser your doctor or your provider has. There are non-ablative lasers and ablative lasers. There are ones that target pigment. There are ones that target the blood vessels to a scar, many of which have been shown to help scarring quite a bit. Most of these need some sort of downtime. Most of them have a significant cost associated with them. You often will need more than one treatment, and the outcomes of your scarring is really going to depend on which laser is used. So I think it really is going to involve in-depth conversation between you and your provider to really kind of set your expectations. So, if you are looking to just completely get rid of your acne scars, your atrophic acne scars at any cost with any risk, then they may consider like an ablative laser that's really gonna kind of just peel off your skin. Press a reset button on the computer, so to speak. Whereas if you're not gonna tolerate much in terms of risk, then generally a non-ablative laser is going to be more up your alley. So there's no like right or wrong answer when it comes to lasers. And there are a bunch of other procedures that can be used for atrophic scarring. I did a lot of these in fellowships. Subcision is one of them. You put this long flat needle underneath the scar and kind of release it. Again, it's going to be good for very specific types of scarring and not others. Dermabrasion is one. Similar to the sort of thought process behind the lasers and the chemical peels and the microneedling, you're basically kind of wiping out part of the skin, causing an injury, triggering the skin to kind of remodel and get rid of the scarring. Punch excision, where you actually just go in and focally take out that scar, close it up, and just try to restart the healing process. And there are always more treatments coming onto the market. So very briefly, I'm going to talk about the last category of deep acne scars, and that's hypertrophic scars. That's if your skin looks like this. So these scars are elevated above the skin. People who are prone to hypertrophic scarring or prone to keloid scarring are again more likely going to have this type of scarring after acne. There's not a whole lot in terms of home treatment that can be used. Silicone gel sheeting is one that I would recommend. Just the same way as a Mohs surgeon, I'll recommend silicone gel sheeting to kind of press down on scars as people are healing. The same way it works for hypertrophic scars. You basically are going to apply at night, leave it on overnight, take it off. You can use the same piece over and over again if you're washing it with soap and water, and that provides like a pressure on the scar that kind of tells it to keep remodeling. Same thing with just massaging the scar. Actually, if you're at home and you have your hypertrophic acne scar and you just kind of massage a little bit, that can actually kind of trigger the collagen to like help remodel and flatten a little bit. But this is not going to be like a home run treatment. Like if you have bad hypertrophic acne scars, this is not going to be enough, most likely. In-office procedures, again, some of these ones I've previously mentioned can be used. I would go to somebody who specializes in cosmetics, in acne scarring in particular, when using some of these procedures for hypertrophic scarring, because again, you don't want to make the scarring worse, you want it to be better. So you need somebody who knows what they're doing. Injecting steroids is commonly used for hypertrophic scarring. That actually kind of tells the fibroblasts to stop what they're doing, chill out, stop growing, and maybe go back down to flat against the skin. There are also other treatments that we use kind of on a case-by-case basis. As a surgeon, I have in certain instances just cut these out. Now, it's very tempting to want to cut it out because it looks great initially, but the issue is that oftentimes a scar will come back just within that area that's been cut out, and sometimes it can even come back bigger. So you really want to go to somebody who knows what they're doing. Oftentimes we'll use radiation afterwards to stop the healing process. Or if patient is not a candidate for that, then we will definitely do those interlesional Kenalog injections after any sort of excision to calm down the healing process and allow it to heal flat. In some instances, especially off of the head and neck, usually, patients of mine who had bad acne on the chest, that's the most common area for acne scarring to occur in a hypertrophic manner. We will use not only interlesional Kenalog, but interlesional 5-fluorouracil with the Kenalog, and that can help kind of destroy the fibroblasts in that area and calm it down, but it requires many treatments, can be painful, doesn't work for everyone. Now, can you get any of these procedures while you're on acne treatment? Usually you can, but again, many of them, like if you're on antibiotics or Accutane, your doctor may or may not want to do a certain procedure while on those medications because they can be light sensitizing, they can affect healing. It used to be the mantra that you had to wait 6 months after Accutane before getting any sort of acne scarring procedure. I actually worked on a systematic review when I was years ago looking at this and found that actually most of these scarring treatments that we discussed can be used immediately after stopping Accutane, with the exception of fully ablative procedures. So if you're really going and sort of wiping out that top layer of skin, then you may be at risk of having poor healing if you've just recently finished Accutane. So again, that's going to be a discussion with your physician, but hopefully that should arm you with that ability to kind of ask the right questions and see when you can get treatment for acne scarring, because the earlier treatment, the better outcome. So hopefully this was helpful for you. If you got some value, please please subscribe for more information like this. Tell me in the comments which things have worked for you. I'm Dr. Abby Waldman. Be well.